Hello, my name is Allison, and today I'm presenting information on robot-assisted therapy in the field of rehabilitation. Robot-assisted therapy refers to the use of a robotic device in therapy. It is also known as robotic therapy or active assistive robotic therapy. The term robot refers to a machine that is capable of performing complex tasks and actions, usually with an advanced level of speed and precision. Rehabilitation robots are very specific, and most of them use sensors to monitor human movement and positioning and then use this feedback in order to interact with the environment. There are numerous areas that rehabilitation robots are currently being used, including speech-language pathology, occupational therapy, and physical therapy. Due to population changes, a shortage of professional therapists, and the increasing scientific and technical potential, many research groups have proposed devices with the potential to facilitate the rehabilitation process. Let's look at the involvement of OT, PT, and SLP now. People working in the fields of occupational therapy, physical therapy, and speech-language pathology may be involved in robotic-assisted therapy in many different forms. The areas of assessment, goal setting, intervention, and evaluation of outcomes can each be facilitated by robotic technology. Robots can be used to enhance each of these four processes that therapists must perform. They can be used to assess performance before, after, and during an intervention, and also provide targeted intervention consistently and repetitively depending on the extent of the impairment. Factors influencing therapist and therapy assistants' inclusion of robotics in therapy is dependent on research, training opportunities, compatibility of the approach over different settings, cost, and input from the licensing bodies in each discipline area. So how can robot-assisted therapy be applied to occupational therapy? There are numerous examples of robot-assisted therapy being used to improve clients' abilities to perform the occupations of life. These clients range in age and may have physical, developmental, or cognitive impairments that limit their ability to perform tasks. For example, in 2017, the Open Journal of Occupational Therapy published an article titled "Outcome Measures with COPM of Children Using a Wilmington Robotic Exoskeleton." The Wilmington Robotic Exoskeleton, or REX as it's called, is a body-powered 4 degrees of freedom orthoses that allows gravity-minimized movement of the arm at the shoulder and elbow. COPM refers to the Canadian Occupational Performance Measure. The study measured patient satisfaction and performance with use of the REX during activities of daily living, play, and at school in children with neuromuscular disorders. The group contained 25 families, each having a child between the ages of 2 and 21 years with a neuromuscular disorder. The results were measured by the parents who rated their child's performance in daily activities, both wearing and without wearing the REX. Table 1 on our poster shows the activities rated in level of importance by the parents. The areas include self-care activities, productive activities, and leisure activities. So to summarize the chart for you, parents listed self-feeding as the most important skill, followed by communication skills, ability to play, and grooming skills. Other skills rating lower include school skills, body awareness, social skills such as shaking hands, and dramatic play skills. Following the data analysis, the authors concluded that based on the COPM and parent interviews, 24 out of the 25 children had greater levels of performance and satisfaction when they were wearing the REX compared to not wearing the REX. Only one family reported a negative result, stating the device was too cumbersome for their child and it hindered activities. Overall, the use of the REX has been demonstrated to increase range of motion and improve both performance and satisfaction relating to important activities of daily living. Another healthcare field that has been introducing the use of robotic technology is nursing. I interviewed Catherine Schell, who's a registered nurse in Calgary. She has over 20 years' experience in the field and has spent most of her career working with palliative care patients. I asked Catherine about her experience with technology. She informed me she has never used robotics in her line of nursing. She said there's such a huge qualitative, psychological, and social piece for almost every interaction she has with her patients, she doesn't think it would be possible. She could see it used to maybe assist in some procedures, but not on their own. She thought maybe for people who were unresponsive there could be a small role in some areas. I showed Catherine the ParaPet, and she had not heard of it before, and it is currently being used with some patients who have dementia. It is a robotic seal that the clients can interact with. Catherine thought the robotic seal would be a great idea for someone who is agitated, confused, or restless. She added that touch is a huge tool, and this ParaPet would be something that could provide long periods of relief when an actual pet or family or staff interaction is short. And it could definitely, in some cases, replace the need for meds. I asked Catherine what she thought of robotic nurses currently being used in Asia, and she expressed that the technology would be so new she would worry it wasn't perfected yet, and that could lead to problems. What if the robot malfunctioned and a patient was injured? That would be an awful consequence. So it will be very interesting to see how the fields related to healthcare change and develop with new technology. Now I'm going to introduce Connie, and she will provide information on robotics used in the field of speech-language pathology.
Social robotics in therapy of praxia of speech is the article that I reviewed and summarized. What it involves is the idea from the researchers that they would like to use social robotics in therapy of apraxia of speech. Apraxia of speech is a disorder where the messages from the brain are damaged and not allowing the person to produce sounds. The muscle movements and planning of the motor sequences are disordered. Therapy for apraxia of speech is frequent, intense, and one-on-one with a therapist. The speech movements are practiced several times in order to retrain the muscles and the muscle patterns. This therapy relies on visual, tactile, and cognitive cues for the motor speech production. The researchers believe social robotics in therapy of apraxia of speech to be innovative. They propose using a social robot to assist and or perform the therapy exercises. The social robotic platform, Mini, has been effectively used for therapy of motor impairments and was also used in this study. There's a screen for visual reinforcement. It's interactive, and it could maximize the human resources. The method was offline phase learned the set of mouth movements using 14 users. The online phase ran the software in the social robot Mini for speech therapy exercise with 7 new users. The researchers believe the results to be promising for the use of social robotics in therapy of apraxia of speech. The next stage would be to test it with real users and therapists. Funding has been received following their research. So social robotics, therapy of apraxia of speech may become reality.
Robot-assisted gait training and physical therapy. There are significant amounts of research that are being conducted to determine the effects of using robot-assisted gait training combined with physical therapy as opposed to physical therapy alone. The article that I have chosen studies individuals who have suffered a stroke as participants to determine whether robotics can improve their ability to function in relation to gait patterns. The individuals used in the study are classified as ataxic post-stroke. It is common for individuals who are post-stroke to have asymmetrical gait patterns. Robot-assisted gait training helps the individual to relearn motor coordination through repetitive practice of the different stages of walking. This repetitive movement that the robot helps to provide allows the nervous system to develop new circuits between the sensory pathways and the motor center for more effective coordination. Robot-assisted gait training presents some advantages over typical treatment. Robot-assisted gait training allows for increased training duration, more symmetrical gait patterns, it can be operated by one therapist alone, and it reduces the amount of physical energy the therapist is required to exert. The study also showed that robot-assisted gait training results in more symmetrical muscle activity than conventional treatment does. However, the study shows that there are some disadvantages to using robot-assisted gait training in physical therapy as well. A great source of concern is that the use of robotics decreases patient effort as the robot facilitates the movement. Voluntary movement is reduced, which may hinder the ability to be as independent as possible. This may negatively impact the effectiveness of treatment. Another research article discusses a new method called the assist-as-needed mode of robot-assisted gait training. The guidance provided by the exoskeleton of the robot can be altered depending on the goals of treatment. This new method works to overcome the barriers that robot-assisted gait training has been associated with. It allows the individual to have the support and assistance that he or she needs to be successful while still allowing the individual to be active in the process. This study consisted of 24 participants initially, however 12 dropped out during the assist-as-needed application. All of the subjects suffered from a hemiplegic stroke. In this study, one group of individuals had the assist-as-needed robotic exoskeleton applied to the unaffected limb, and the fully assistive robotic exoskeleton was applied to the affected leg. In the second group, the assist-as-needed exoskeleton was applied to the affected leg, and the fully assistive exoskeleton was applied to the unaffected limb. Participants wore a suspension vest and a harness that were connected to a counterweight system. The participants then walked on a treadmill using the assistive robotic devices. This study showed that applying assist-as-needed exoskeleton to the unaffected limb led to gains in asymmetrical step length and improved hip extension of the unaffected limb. The fully assistive mode for the affected limb helps to increase stability when the foot is planted and allowed participants to voluntarily move the unaffected limb in the swing phase. This results in increased step length. This study also showed that applying the assist-as-needed exoskeleton to the affected limb may help normalize ankle movement during the swing phase. Participants were able to maintain task performance after a series of training with the assist-as-needed method, even when the exoskeleton was removed. Fully assistive, robot-assisted gait training showed that individuals had poor performance once the exoskeleton was removed. The successful application of the assist-as-needed robot-assisted gait training allows for voluntary leg movements, which is very important to the goal of rehabilitation to help an individual be as independent and functional as possible. At the bottom of this summary on the poster, we can see the assistive devices and how they are applied to help the client move through different gait exercises. The impact of robotics on therapy assistance. Robot-assisted therapy provides opportunities for rehabilitation assistance like speech-language pathology assistance, occupational therapy assistance, and physical therapy assistance to be involved in the therapy process in a different way. Assistants would have a variety of roles in helping maintain the robotic technology and in implementing the technology. Assistants would be responsible for setting up and putting away the robotic device. The assistant would also be expected to sterilize the robotic devices that are used. If permitted by the supervising therapist, assistants may also help the lead therapist carry out the intervention. The role of the assistants may be to help adjust the robotic device to the client, to record notes and data that is produced, and to help guide or direct the client through a series of tasks and exercises. By using robot-assisted therapy and treatment, the roles and the responsibilities of assistants would shift. In conclusion, robot-assisted therapy is a rehabilitation approach that is facilitating the quality of intervention given to clients with a variety of disorders and impairments. Advances in robotics can lead to improvements in all areas of rehabilitation, including occupational therapy, physical therapy, and speech-language pathology. Robot-assisted therapy is capable of aiding the client through a variety of tasks depending on the objective of therapy. In the past, robot-assisted therapy has been used, but as we continue to progress in modern times, new adaptations are developing to increase the effectiveness of robotics on therapy goals. As knowledge in robotics grows and adaptations are made, we have an opportunity to improve the quality of intervention that a wide spectrum of patients will receive. Research continues to reveal ways in which we can improve upon and utilize the assistive device in rehabilitation in the different fields.